Hello everyone, my name is Dr. Shahbaz Ansari and here I am yet with another video. In this video, I've been thinking to take you along my own calls for a while, that what really happens.
Tell your future like a psychic. Baby, you gon' end up right in my bed. Chemistry is science.
Orthopedic night on call, and in this video, I'm going to be taking you through my night on call. What do we do as an orthopedic SHO, what is expected, and what really happens. So the shift starts at around 8 p.m. where the handover happens between the day on call and the night on call is handed over the leftover jobs or whatever patients that needs to be seen, if there are any x-ray that needs to be chased, and if there is anything that needs completing either from the wards or whatever comes to A&E. And we do keep a handover that we discussed in the trauma meeting, which is more like a war meeting in the morning where we are grilled upon the decisions that we make. So we have to justify all our decisions as well. As far as they're justifiable, you're okay. And if there is something that you did right, you'll be appreciated, which rarely happens, and you'll be criticized or you'll be taught on the things that could have done better. So it's a really good learning point as well. So yeah, I am started my shift maybe 30 minutes ago, and so far I've just sorted out some things that were handed over to me by my day on call. And yeah, we are waiting. Where's my bleep gone? Yeah, that's my bleep on which I've mounted the phone on. And whatever comes in that bleep, I have to respond to it, and it depends upon the case whether do I need to see them physically or we can see them in the clinic, or there's something called virtual fracture clinic as well. We can organize that. In this job role, we do cover other sites as well, which is Fairfield. So in that scenario, we just have to make the decision on the phone. Have you tried reducing it at all? Do the due diligence on the phone, review the x-rays and whatever needs to be done. And if I believe from my assessment on the phone that I need to see this patient physically, so I just bring them over from there and assess them and basically decide whether they need admission or can I treat them as an outpatient. So yeah, as the shift goes along, I'll walk you through my shift and hope you like this video. Okay, cheers. And when was this injury? 6 days ago. What made her come today? Did she have a fall? Yeah, it's going to be very difficult to reduce it if it's 6 days old. No, she needs to come in. Yeah, that's fine. So if you transfer her to North Manchester, I'll take care of it. So just saw a patient, a young girl with an elbow injury who was... This vlogging thing is very difficult, to be honest. Yeah, so just saw a young girl who presumably had an iPad fallen on her elbow, and the nurses thought that there was a foreign body. There was no foreign body, so just washed it out. Had a good look, super glued it and sterile stripped it and discharged. So far it's a very mellow night, so I thought I'll just grab a moment and have my food and enjoy it while watching a few videos, and after that I'll be doing a bit of studying and making a few. I've got biryani today. My beautiful wife has made this, so I'm going to enjoy this meal. So yeah, I try to sleep on every night whenever possible, but I do not know why I can never fall asleep when I'm night on call because of the alertness in my mind. What if I get a bleep? I have to walk over to the phone, see the computer, see the patient. So there's what's the point? So that's why. But I do try and A for an effort. I can't sleep. That's another thing. So, So this is 3:30 a.m. I'm just coming back from the ward where there was a patient. He came in with spiral tibial fracture and he was complaining of significant amount of pain. So I just wanted to assess and I was thinking of compartment syndrome really, which is sort of a surgical emergency in a patient who has got such type of fracture. So I've increased his analgesia and I'll reassess, and I've alerted the anesthetic team as well because he is an IV drug abuser, so we may struggle with cannulation. So you have to think everything in a holistic manner. And I am waiting for a patient who is yet to come from Fairfield. So let's see. I've got 4 more hours, so hang tight. So it's nearly 7 a.m. and I have completed seeing all the patients that were presented in the A&E. Quite a few actually that came on coming. So I've marked and consented everyone and prepped whoever needed to go to surgery. Now what I'll do is I need to just get on the computer and prep my handover. I've already prepped it, but just make sure that everything's up to date on the handover, and then I'll see you guys once I've presented all the patients. And yeah, so finally I'm done with the night on call. I've presented all the patients, obviously got a bit of grilling done for my mistakes, but yeah, it was a good day. I learned, and now I'll head home and see you next time.